We're calling this. Okay. Good morning, everyone. We're going to call this meeting to order. Welcome to our first of 2 June SEB board meetings. Our meetings this year will continue to be hybrid. Healthcare Authority staff will be on site. Board members and other attendees have the option of attending on site or via Zoom. For our Zoom attendees, our opening slide has information about how attendees can turn on closed captioning. We're going to do roll call starting with Donna.
Good morning.
Morning. Carrie.
Good morning.
Pamela.
Good morning.
Myra.
Good morning.
Allison.
Good morning.
Terry.
Good morning.
Omid.
Good morning.
Morning, sir. Amy.
Good morning.
Good morning. And we have Katie Hatfield from the AGOs. Good morning. And I'm Lou McDermott, Deputy Director here at HCA and the Chair of the SEB Board. All right, this meeting is a little different than our normal format. We're not going to have any presentations, I believe. We're going to have an exec session. And because we're having no public presentations or resolutions scheduled for today, the primary purpose is going to be the executive session, but we're going to give the public the opportunity to provide any general public comment before we go into session. Dave, you want to give us an overview?
Yes, it is an unusual meeting. First, I just want to apologize and thank you for having Jean chair or be my role, not chair, but be my role in the last meeting. I was definitely ill. It's the first that I missed a board meeting due to sickness. So you know that I was really not feeling well and I was able or willing or unwilling really to miss a board meeting, but it was the right thing for me to do. And I encourage people to use their sick leave when it's appropriate. And that was definitely an appropriate use of sick leave. But I'm back. We're here for a very quick meeting from a public standpoint. Today, we are having you review the meeting minutes from the meeting I wasn't at. And then we'll go into executive session. And all of this is related to the rate development process. But it is important for us to gather to talk about the rate development process so that we can be on time for the public previewing and then ultimate final action by the board related to premiums. It is a quick meeting, but if we have an emergency, we run across where we walk purposefully across the street to the visitor parking lot.
Well, we run.
And if you need the restroom, run or walk, depending on the scale of the emergency, down the hall, see elevators to your left. And with that, we'll go back to you, George.
All right, thank you. And for the record, Jean did crush it, and you were almost voted off the island. All right, we're going to go ahead and approve some meeting minutes from May 2nd. Where are they? Are they in a tab or are they tab 3? Excellent. Do I have a motion to approve?
Chair McDermott, I move to approve the May 2nd minutes as presented.
Actually, one sec. Any comments from the board?
No, you need a motion.
I move.
No, we went with.
Oh, yeah, you're right.
Yeah, comments first. Are there any comments? Hearing none, we have a motion. Do we have a second?
This is Donna, I second it.
All in favor, say aye.
Aye.
Any opposed? Hearing none, and also realizing 2 days no sleep, things are not clicking all the way.
We'll take it.
Yeah, I'm like going, hey, read the next line. It's like, no, I can't. Okay, public comment. Do we have anyone out in Zoom land that would like to raise their hand and provide some comment? Nothing?
Got people coming in, maybe ask for time.
Okay, looks like people still joining us. We're in the public comment portion of the meeting, which has just started, so that is unusual, but we're at that point. Anybody would like to make any comments? Mackenzie? All right, seeing none. Our next meeting is going to be business. We're doing this right?
Yes.
Our next meeting is going to be June 20th, starting at 9 a.m. Same format of attendance in person and Zoom. Dave, any final comments before we go into executive session?
Sure. We were trying, we could have had a public presentation today, but we wanted to kind of respect both the board and public's time and why come for a public meeting of 20 minutes when we can just have public engaged in a single meeting later in June. So we have a couple of topics that we know we're going to be doing at the June 20th meeting. We anticipate that we might have a small executive session at the start of the meeting, but then the June 20th meeting is where we anticipate putting the rates out in public, introducing the resolutions, that would then be the mechanism for setting premiums for the next year at the subsequent July meeting. So that's really kind of the core part of the June 20th meeting. We also thought it would be good, we're 5 years into the program, to do a kind of a retrospective enrollment review as kind of trends across the program. And so we put that together. And then we've spent a lot of time in the PEP program talking about Medicare and Medicare work. And we've tried to keep this board a little bit apprised of some of the work since the way I say it is all of your members graduate into retiree coverage that's over in the PEP program. So we thought we'd do kind of a wrap up of where we are on Medicare in the PEP program. And then I know you're all really anxious to get on your calendars the 2025 board meeting schedule. And so we'll bring you that draft schedule at the next board meeting. So with that, that's today. I'm trying to beat Gene's 38 minutes.
You're crushing it. Then you're back on the island. Is any questions for Dave? All right, we're going to transition to executive session. It's going to happen here in the Sue Crystal Room for board members and included HCA employees. At this time, members of the public joining us in person at the Healthcare Authority today, as well as employees not part of the executive session, will be asked to leave. It's a little stronger written here, but we're going to say
Escorted out.
Yeah, escorted out, asked to leave during the duration of our executive session. We're going to be calling back to join us in Sue Crystal for the remainder of the public meeting, which is intended only as a brief statement to adjourn the meeting. Pursuant to RCW 42.30.110, subsection 1L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchased healthcare services as provided in RCW 41.05.026. The executive session will conclude no later than 11:30 a.m. Board members, let's take a break after our exhaustive morning, and we'll return to the public meeting to adjourn after executive session. All right, thank you.